My name is Mark Ziegler. I'm a physician assistant up in the family medicine office here at Witham. I chose to be a PA partly because I always knew I wanted to go into medicine and I wasn't sure exactly what that looked like. And I ended up shadowing my dad, who's a physical therapist, and then my mom, who's a nurse, to kind of get a feel for those professions. And they both kind of recommended either the PA or the nurse practitioner route. I chose family medicine because starting out as a PA, I knew I wanted to do something where I would have exposure to lots of different areas of medicine, whether it's cardiovascular issues or pulmonary issues or mental health issues. And there are only a few areas where you can do that. One of those is family medicine. You see a little bit of everything up there. I chose to practice at Witham because my dad is actually a physical therapist here. He's worked here for 25 years. So growing up, we would come visit him for lunch and things like that. So I had exposure to the hospital before, even though I'm not from the Lebanon area. I knew coming out of PA school that I wanted to work somewhere in the close to the Indianapolis area, just because that's where I'm from, is Carmel. And I knew I wanted to live somewhere close by. So with hit on the fact that it was familiar. It's also close to where I knew I wanted to settle down and live. I think the biggest misconception that patients have about healthcare that I wish could be corrected is that oftentimes patients think if they don't feel anything wrong, like have any abnormal symptoms, they think that they're fine. And while that's often true, it isn't always the case. I think the most important quality that a PA should have when treating patients is just making sure to be attentive and listening to the patient.